Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. How are you? I hope you are in a good condition. So, my name is Sulthania Bilqis. My student number is 27 from English Literature 2019. Today, I will present my PowerPoint from Discourse and Modality courses, and my topic is about discourse and aging. Okay, so this is the table of contents that we will discuss. The first one, we will talk about the definition of discourse and aging. Number two, we have speech development, include child normal speech and child speech delay. The third, young adult, include critical thinking of your young adult. The last, we will talk about older age, include syllable production, identity in old age, and language and communicative in old age. So this is the definition of discourse and aging. Originally, the word discourse comes from Latin. It means discourses, which denoted conversation and speech. Discourse is an increasingly popular and important area of language study. It discusses not only about language itself, but also how it relates with society, culture, and thought. It is used to describe activities in several disciplines such as linguistics, sociolinguistics, and psycholinguistics. While aging, it is a normal development factor and continuous lifelong process that begins at birth and ends in death. In humans, aging represents the accumulation of changes in human being over time, encompasses physical, psychological, and social change. Next, this is the speech development over time. Children develop language at different rates, and this is the most intensive period of speech and language development for humans is during the first 3 years of life, a period when the brain is developing and maturing. This is the speech of children, the step speech of children. By the end of 3 months, child might cry differently or for different needs. For the example, when they are hungry or uncomfortable for the situation, the baby or the child will crying. And then the next, by the end 6 until 11 months, child understand what people say, such as no and say mama, or maybe they are saying dada. Next, by the end of 18 months, child can answer simple questions non-verbally, and the child can say 2 or 3 words, but pronunciation may not be clear. In this age, child try to communicate using sound and imitating and words, particularly when needing help or wanting something. And this is also a step speech of children. When children 2 until 3 years, they begin to use simple phrases such as request, such as more milk, and follow simple command and understand simple question. And the child can speak about 50 or more words. The next, children with 4 until 5 years can understand complex questions and can use many descriptive words spontaneously. And the child knows common opposite. They can differences between big and little, hard and soft, heavy and light, and etc. My explanation before, it is about normal speech development of children, but there is also children's speech delay. What is different between speech and language? They are often confused, but there's a distinction between the two. Speech is the verbal expression of language, and it includes articulation, which is the way sound and words are formed. While language refers to the entire system of expressing and receiving information in a way that's meaningful. That's why sometimes child may have receptive language skills that are good. They understand what people are saying, but they have expressive language problems, meaning that they cannot get words out that they're trying to say. Next, what sign of speech delay? A child with speech delay might use word and phrase to express idea but be hard to understand. By 12 months, isn't using gestures such as pointing or waving bye-bye. It means that the child not given any responses. Next, by 18 months, has trouble imitating sound and do not understand simple verbal requests. Next, child with 24 months can only imitate speech or action and doesn't produce word or phrases spontaneously. And still 24 months, a child can follow simple direction. It means that child have their own word. So what cause of speech delay? A speech delay might be due to an oral impairment, like problem with the tongue or plates. It means that the roof of the mouth. And the second cause, a short frenulum. It means that the fault beneath the tongue, which can limit tongue movement. Many kids with speech delay have oral motor problem. This happens when there's a problem in this area of the brain responsible for speech. This makes it hard to coordinate the lips, tongue, and jaw to make speech sound. There's also another cause of speech delay. It is hearing problem. Hearing problem also can affect speech. Child who have trouble hearing may have trouble saying, understand, and imitating sound and using language. Parents who have children with speech delay have to go to the doctor and check their child and get the solution for the doctor. Usually, the doctor recommends for therapy speech. The speech therapist will work with the child to improve speech and language skill and show you what to do at home to have the child improvement of speech development. Next, let's talk about young adult. When we are getting older, we do think critically. We be able to debate, discuss something with our friends, with others, and give an opinion or argument and found the result of the discussion. And it is called critical thinking. Critical thinking is the ability to think clearly and rationally about what to do or what to believe. It includes the ability to engage in reflective and independent thinking. Okay, next let's talk about adult with critical thinking skill is able to do the following. They understand the logical connection between ideas. They are also can identify, construct, and evaluate arguments. Detect inconsistency and common mistake is reasoning also include people with critical thinking, and they are also can solve problem systematically and identify the relevance and importance of ideas. So people who think critically consistently attempt to live rationally, reasonably, and empathically. They use the intellectual tools that critical think offers, concepts and principles that enable them to analyze, assess, and improve in thinking. Adults work diligently to analyze the intellectual virtues. Next, older age. It includes syllable production. Older age experience more word finding failures and more field pauses. For example, saying during speech production along with overall slower rates of production. You know, when you look at the people who have older age, they are mostly talk and mention in the middle of their speech. The production challenge might be caused by difficulty with lexical item or difficulty accessing the correct speech sound associated with a lexical item, or may be difficult forming the appropriate modal plan. The fact that the older adults take longer to make sequential speech movement and make more articulatory error is consistent with at least some age effect on motor planning production. Next, still older age, we talk about identity in old age, include communication with older age. The communication process in general is complex and can be further complicated by age. One of the biggest problems physicians face when dealing with older age is that they are actually more heterogeneous than younger age. Communicating can also be hindered by the normal aging process, which may involve sensory loss, decline in memory, slower processing of information, and etc. So, what should we do then? When we talk to older age, we have to sit face to face. Some older age have vision and hearing loss, and reading your lips may be crucial for them to receive the information correctly. That's why sitting in front of them may also reduce distraction. Next, when we talk to older age, we have to maintain eye contact. Eye contact is one of the most direct and powerful form of nonverbal communication, and it creates more positive side. Next, we have listen. Good communication depends on good listening. So, be conscious of whether you are really listening to what older age are telling to you. Next, speak slowly, clearly, and loudly. The rate at which an older age learns is often much slower than that of a younger person. Don't rush through your instructions to these people. Speak clearly and loudly enough for them to hear you, but do not shout. It means that, as I said before, older age have problem with their hearing problem, so that's why we have to speak slowly, clearly, and loudly, but do not loud shout. Next, language and communicative in old age. Some scholars interested in the relationship between discourse and aging are drawn to questions relating to the relative decline, maintenance, or improvement of language and communicative abilities that accompany aging. Some of the research looks specifically at subgroups of the overall elderly population who are known to have difficulties with communication, such as individuals with Alzheimer's disease and other dementias and different types of aphasia. Alzheimer's are 65 and older, and it is not a normal part of aging. Alzheimer means that lose the ability to carry on a conversation and respond to the environment. Next, technique in conversation and use of language. When you talk to older age, you have to appropriate speed and tone of talking, such as accent and dialects. Strong accent and different dialects can make it problematic for people to communicate. It is have to be aware about word that you use or the accent or the dialect that you use. It means that when you have wrong dialect, it can be misunderstanding between you and the partner of the communication. Next, appropriate questioning. Use a leading question to elicit elders such as yes or no reply. And then the next, you have to use simple and concise words, such as when you talk to an older age, you have to say polite words, such as take one fruit after each meal. It is better than you say take more fiber. It's a really impolite for them. So be aware to the word that you use. Impolite is better than you talk informally for the older age. Next, technique or nonverbal communication. There are posture and gesture. For the example, nodding, appropriate movement, appropriate position of chairs, and the other posture and gesture, as I said before, we have to sit face to face and maintaining eye contact, and then we also listen. I think it is not about when we talk to older age, when we have a conversation with others, with our friends, we have to uh, look at the posture and gesture for the communication, because it is important. You have to listen for others, um, to respectful for them. Next, attitude: be friendly, kind, sincere, and respectful, avoiding being impatient and indifferent or contemptuous. Next, facial expression. It means that reflect different moods. You have to have a reflect mood. When your partner tell you a story for happiness, you have to reflect moods such as exciting, or give them really high moods to respectful for their stories about to tell to us. And then the opposite, when they are shared to us about the sad story, we have to respectful of them. It means that reflect different moods is a really important to technique or nonverbal communication. In communication with elders, we must try to be understanding and to be adept at expressing ourselves. The effect of communication is the result of the mutual influence, just like a mirror. The accomplishment of good communication relies on effort from both parties. Okay, so this is the light side. Thank you. I think it is enough for my presentation today. And the topic is about discourse on aging. Thank you so much for your attention. And when you, if you have any question, just drop in the comment boxes, and I will answer the question in the next meeting with the classes. Thank you so much. I'm Sulthania Bilqis. My student number is 27 from English Literature 2019. Wassalamualaikum warahmatullahi wabarakatuh.